Hi everyone, and thanks for joining. My name is Sarah Gettle. I'm the Director of Capacity at One Love Global, and we are the place lead for Truth, Racial Healing, and Transformation of Metro Lansing. One Love Global is a Black-led organization committed to transforming communities so that justice, peace, and opportunity are attainable for all children. Central to this is helping young people to realize their power and lead. Today we are presenting racially equitable responses to COVID-19, hosted by Dr. Pamela Pugh. Dr. Pugh is the founder of Regeneration LLC, which serves as a catalyst for economically sustainable and healthy urban communities by assisting public agencies, organizations, and businesses in building capacity through effective operations and winning partnerships. Dr. Pugh previously served as the Chief Public Health Advisory for the City of Flint, Michigan, and worked in the Saginaw County Department of Public Health. She earned her PhD from the University of Michigan School of Public Health and her BS in Chemical Engineering from Florida A&M University. So without further ado, I will turn it over to you, Dr. Pugh.
Pandemic, not that this has ever or it has been it's not something that comes about often, but the disease, it was a new disease, a novel disease, a coronavirus that had never been seen before. We know there are several coronaviruses, and we had several people who were saying, hey, you know, on the back of my Lysol can that says coronavirus. So coronaviruses are not new. They're plentiful. But this one was new. The virus that caused coronavirus was new, and there's still a lot that we're learning daily about this virus. So COVID-19 was what it was named. Part of the naming was also so that we didn't have any issues in assigning blame to anyone. So making sure that to be sensitive to certain populations that were already being blamed for this disease, we started to see an uprise in racial attacks towards certain groups of people. So that was also a part of the naming. That WHO wanted to make sure that the World Health Organization wanted to make sure that we were setting that straight. So the CO is for corona, the VI is for viruses, and the D is for disease. And the first cluster that we saw that was seen was in 2019. So 19 is for 2019. The disease is caused by the SARS CoV-2 virus. And so again, this was a new virus related to the SARS virus that we saw some years ago, but not, again, it was a new virus, a new disease. So just looking at the timeline here, again, the first cluster of cases of pneumonia was in Wuhan, the city of Wuhan, a city in China. That was December 31st, 2019, that the World Health Organization in China made the first reports. January 10th, the World Health Organization began to put out technical guidance for testing, detecting to all countries, including the United States. January 20th was the first U.S. COVID case, and that was in Washington, the state of Washington, and that was a person in their 30s who had traveled to China, had Wuhan, and had started to recognize symptoms that were resonating in the news. So went to the hospital, and indeed they were diagnosed on January 20th, somewhere around there, and they were positive for COVID-19. January 30th is when the World Health Organization finally did declare this a public health emergency. It was only the 6th time that the World Health Organization did this since the existence of the group that makes these declarations. And it was also at this time that it was recognition that was community spread. Up until this time, it wasn't clear how the virus was spreading. And so it became clear that it was spreading from person to person in community. February 11th, as I mentioned earlier, is when the coronavirus, this new coronavirus, was labeled COVID-19. And I got to keep moving your faces around to be able to see. February 28th is, yes, so that was the first death, and that was in the state of Washington. And it's also when Governor Whitmer opened up the Emergency Operations Center here in the state of Michigan. Then on March 10th, on election day, that was the first COVID-19 case. And so that there were 2 cases that were detected here in the state of Michigan. Again, those were cases that were detected. When we talked to the state of Washington, I was on a call with them and other counterparts throughout the country. And the state of Washington definitely states that based on what they're seeing on the looking at the genetics of the strain, they see that there was mutations that also show them that this was resonating prior to when we first thought. That's probably something that you all have heard. No new news there. We also know that it was resonating here in Michigan before March the 10th. So then March 11th, who declared COVID a pandemic finally? We know that from there we also had the closure of the NBA. NCAA a day later declared that they would not be holding their season would also cease. And then there were several other things that happened. I think I was on a call on March 11th, March 12th with the National Association of State School Boards, as I am a state school board member, and some of my friends who do have an environmental background and work in the schools. And so there was discussion around, are we supposed to focus be on cleaning schools and sanitizing schools, or should we be telling people to, making sure that folks knew that they needed to close schools? And so as we were on that call that day, and I think that was March 11th. Yes, it was March 11th. And so that day, my question was, and my thoughts were, we need to be giving school districts the head nod, the okay, if possible, telling them, hey, this is when we're going to close schools, because we knew that it would take a while for parents to be able to adjust to this. At that time, parents would still be working. And so that was one of the first clarion calls that I made is, hey, parents, this is going to be coming. It's not a matter of when, it's just if. And so thank God, I think it was a day later, our governor, along with our state superintendent, did close our schools here in Michigan. So then there are several things that followed that, and we'll go through that as we go. As we look at the testing in Michigan, and you can look at the testing here. Let me see, I don't have my notes up. But if you look at Michigan as it relates to tests, we are 4th behind Michigan for the number of cases that we have. However, we are far behind as far as the number of tests that we are giving. And I'll pull some of those numbers up shortly. I'm not looking at my notes slides to give those to you, but the dark blue or the grayish blue are number of tests that have been done up until like April 12th, but the reporting was April 14th yesterday, but it was up until April 12th, the testing. So you'll see that we lag in testing, but we still are pretty high and ranked number 4 for the number of cases. So that's concerning. But we can just point out that we had 27,000 cases as of yesterday and over 1,700 deaths as of yesterday here in Michigan. And those numbers come out every day around 3 o'clock, and they report as of 10 a.m. And so these are some of the the US. Around 3 million tests have been done in the state of Michigan. And then we're up to 600,000 cases and 25,000 deaths. Some of the testing can be repeat testing as well. So I just want to note that. And we may not capture all the testing. And there's such a lag in the test as well when we look at the whether it was positive or negative. And so this is Michigan and the number of tests to your left. You can see how testing has gone up. And you can also see to your right where we started March 11th when we noted the first cases and 0 deaths. The number in the aqua that's on the chart to your right shows the number of cases and the number of deaths. So March 11th, we had 2 cases and 0 deaths. And then you will see on April 15th, well, actually that's April 14th. It should read April 14th. We haven't gotten the numbers for today yet. So I'll change that. So note that's April 14th. But there's 27,000 cases and around 1,800 deaths. And so you can see we're continuing to go up. But what Michigan is reporting is that the number of tests compared to the number of positives they're seeing a trend in going downward. But hopefully we will be doing more tests. The governor did announce this week that we would have more testing sites. And let me say, today, I'm typically once a week, I'm on the White House calls as a state official. And so on those calls, we hear a lot about the testing we've heard about a rapid test that's come out. We've heard about testing sites going up, more PPE, but it just does not translate to the ground. And so we'll talk a little bit more about what that has meant for communities, certain populations here in the state of Michigan. So, one of the things that those of us who have been in public health, I'm sure Angela and Sarah, we saw the storm coming. We cried out, we were asking questions. There were just certain things and patterns that we saw. And we knew that, as my friend Dr. Abdul El Sayed said a couple of days ago, COVID-19 would follow the path of insecurities. And so we'll talk a little bit more about that. And so again, this was therapeutic for me, because as we were seeing this unfold, as we saw the numbers shooting up, as we saw the testing, there being the number of tests that were actually here and accessible to people versus what we were hearing from Donald Trump, is that it was not matching up. And so I'll tell you a little bit about some of the stories. Sarah, do we want to pause for a minute and take questions on any of the data that was presented? Because if so, I can pull up. Do we want to pause and are there any questions?
Yeah,
I can.
Angela, how's it looking over there?
Yeah, we've got a couple of questions here. One question is it called 2019 because it was discovered in 2019? And what do the other 2 colors on the graph represent? Okay.
Good question. Let me pull up my slides. So I didn't put it on here, but yes, so it was 2019 because that's when we first saw the cases. I'm sorry, I didn't put that on here. But yes, that is accurate. And let me I want to pull up my data here. And we'll go back to those slides, Sarah, with the charts. But one is the death. So to your far left, the grayish blue, the darkest blue is the number of tests. Of course, we're testing more than the cases than we should see. And then the middle color is the number of cases. And then the number to the far right would be the number of deaths. And let me see if I can get these numbers for you. For instance, New York is testing around 500,000, have tested around 500,000. This is a cumulative number count. And so they tested and so 202,000 would be that aqua color in the middle. 202,208 is the number of cases. 10,834 people have lost their lives, have died from COVID. When we look at New Jersey, they've tested 139,000, so almost 140,000. and for same time period as Michigan. And then their number of cases is 68,000, around 69,000. Their number of deaths is 2,800. Let's just go down to Michigan, 86,000, and we have 86,000 tested, 27,000 cases, and almost 1,800 deaths. Let's look at California. California tested 202,000 people and have 23,000 deaths. So that's startling. I mean, 23,000 cases and 758 deaths. So that's startling to me when I look at those numbers last night as I was crunching these numbers. And so I will look at these numbers a little bit more, Angela and Sarah. And but this is the data that's out there. Actually, this is a website on Politico that reports out to most of the news media are using the database that they use. But I did also go to Michigan Department of Public Health. Michigan Department of Health and Human Services. I'm telling my age by using the old name of the department. But and they do they pretty much match up. Some of the testing data is just a little bit off, but that's startling. That scared me to see that we're testing that low of a number, but getting that high of incident rate and death rate. It's startling to me. Okay, so are there any other questions?
One more question that I don't think is actually covered in the content here, but I'll put it out there since it was asked. By comparison, how many deaths by the common flu in a similar time frame?
Good question. That's something that maybe, Angela, that if you guys can note, I'll try to see if we can find that information.
Okay.
See if we can
Thanks,
find
Pam. That's all the questions for now.
Okay. So these were some of the things that were really concerning to me and weighed heavy on me. So one of the first calls that I received, it was a person that worked at one of the hospitals. And so it was their mom who was concerned about their child. And one of the hospitals was told that they could not wear masks or any protective equipment. Not only was it not going to be provided, but they couldn't wear it because it was a bad look for the customers. And so this was disheartening for me, especially seeing, just seeing the storm coming. And then some of the stories that they were telling me about some of these workers, and these were the frontline workers. These were the people like in the lower left-hand corner. These were the people who the folks were coming up to and did not know what their illness was. They were the smiling face that would have to confront these people and then find out that they had symptoms maybe that were COVID related. And so they were not allowed to they were not provided, and they were not allowed to wear it if they had it. And so they had folks who had various medical issues, moms that were going home to their children, so on and so forth, families. And so I did have friends that worked for that medical, for that particular hospital. And so I did talk to them. The first person that I talked to said, hey, Pam, that just doesn't sound right. They should be provided this protective equipment. And they gave me another person who was their director. And so they said, hey, let us talk to them. But right now, we're not providing that because we're telling the people who are walking in who have symptoms to put on a mask. But we knew that was hit or miss. And we knew that the mask that they had, it was just hit or miss, whether or not somebody would have a mask on. So the next thing that we did is, the parent guided them and they went to OSHA. And so that eventually changed. But if you see the date on that was March 27th. So we have a lot of frontline workers, and we now hear it on the news. We know that there are people who were actually treating patients that did not have the personal protective equipment. So this is startling for a person who has a background in environmental health. I just couldn't even imagine not having the proper personal protective equipment. But so we heard these stories more and more. And so we can go ahead and advance. And let me just say this, and these, as you see on one of the slides, the parent and the child were pointing out that these were the lowest paid folks. But then again, like we said, we found out that several people did not have enough personal protective equipment, whereas these people didn't have any. Then there began the concerns around testing and being able to be tested. So one of the first experiences that I had was a young guy who was not feeling well, had multiple symptoms, went to be tested, but they were told to leave, and I hope I took out all of the information. So so they were told to quickly leave because they probably only had the flu, and they needed to stop infecting people and leave the lobby area at that hospital. The person persisted, and they had a driver that was driving them around, and so they went to another hospital in that area. And so when I did contact, one of the text messages here is me contacting someone that I knew in the facility. They said, hey, tell them to come back. But by that time, they had already gone over to one of the other medical facilities. And so they were able to be treated. They had probably 2 drivers between that time, an Uber driver that was driving them around from hospital to hospital. To your lower right-hand corner, there was, this is another area and another person who I spoke with who was having issues getting tested as well. It took them weeks to get tested, and they had multiple symptoms. And so it took them longer. And so we were seeing not only that people could not get tested, but my question to them was, did anybody tell you to tell the Uber drivers that are driving you around that they were possibly exposed to the virus? And then this other person, did you tell your family members that you and them need to quarantine because you're not tested, but you need to act as if you're positive? So those were huge concerns, not only that people could not get tested, but also that these people were very likely to have contracted the disease, but were walking around and exposing others. And then those other people in turn were exposing that many more people. And let me say that the night that the young man who was able to be tested, at that same time, I mean, it was the wee hours of the night that I was, maybe even in the morning, you can see that it was like 1:15. I learned that my uncle passed on that day, and they lived in upstate New York. We would later find that night, we started putting the pieces to the puzzle together, that he too was exposed to COVID. And so his wife was later diagnosed. There were several family members that had to be quarantined because they went to the home. There were several first responders. There were funeral home folks that had to be quarantined. And then there was a church that had to be shut down. And so having one of the first, that experience, having all these experiences at one time, just opened my eyes up to how quickly this thing would spread through our communities. And so we know that the communication was poor, and we know that there was a lot of misinformation. We're learning, this is new. So a lot we're learning, but then some things were purposefully, we were misguided on and purposefully suppressed. And so we do know that President Trump, for a long while, downplayed the severity of this illness, and how, and with that came mixed messages. and it made it difficult, and it really slowed the process for reacting. The resources were not there. We had some communities, one community in particular, I heard their community leader stand up, and that must have been on March 19th. I heard them say, "Hey, we don't have any cases in this jurisdiction." And they said, "We don't have any cases, and it must be because we're doing things right." When in actuality, we didn't have testing going on. It was very difficult for people to get testing, and there was a tremendous backlog and lag in reporting of data, and they would soon find that out. Then there were certain sites. It was a lot of, one of the communities that I was working with, I kept asking them, "Hey, people are not getting the information. They're not getting the right information." And so they were saying, "Well, just tell them to go to the health department website." And I worked in the health department. You all heard Angela say that I worked in the health department for 14 years. And so I have a tremendous heart. My heart goes out to health departments, and especially the load that they carry, and have tremendous, their staffing, resources, you name it, has been cut over the years. But the messaging was just not there. It was not there for the general population, let alone specific populations that we saw this storm coming and heading their way. So we know that some of our institutions are rigid, again, inadequately funded, and just ill-equipped for something like this that we've never seen before. I worked, when I was at the health department, I was the PIO, Public Information Officer, for H1N1. And I had an opportunity to tell the former Homeland Security Secretary, Janet, I always mess her name up, so I won't say it, but I had the opportunity to thank her on a call. Actually, it's like the day before our election, because I was asking her, what are we going to do about elections? Because obviously it's resonating in communities. But I had the opportunity to thank her and say, with H1N1, there are differences, but with H1N1, we were able to practice. We went through simulations. There were several things that we were able to bombard the communities with information. With this, because the slow response, because of the slow not taking this serious, not taking this as a serious threat. It doesn't matter who it was who did it. It just was not taken as serious and as quickly as we should. And so our response to it and the information getting to the people was very slow. And so one of the communities that we knew we needed to reach, and my niece and I just began to put something together, and we were able to, she and I are both public health folks. We were able to talk to our faith-based folks, because I was talking to my pastor and other friends who are pastors. And so we quickly put together something for the faith-based communities, trying to help them to shift in the way that they do things, especially the populations that they serve. So we quickly put out an infographic that we thought would be useful. We had I had some friends in the medical community to review that. There were discussions that I began to have with folks in various levels of government about my concerns. I also spoke with, you will see here, that I had other folks who had expressed concerns with what they were seeing on the ground. But there really just was not, there was this rigidity, we got this. And this was really before things really hit hard. And you knew that you needed all hands on deck. You knew that you were going to need some very strong allies and community voices that were out there able to get to the different groups and populations that we knew were going to be hardest hit. And so wherever those people were, so there were various concerns that I know I was expressing, others were expressing as well. And so again, the response to me was slow. I could make up excuses for all of these people, and they would be valid reasons, but the fact still remains is that the response was slow. And so we have to deal with that now.
Pam, can we jump in with a question here? And it may be a little further in the presentation, but I want to set this up as you're moving forward. So it's a two-part question. Well, what is the reason that we have such a low percentage of people being tested? And is there equitable access to testing based on the kind of insurance people have, like a private insurance plan versus HMO or Obamacare, or even those who are uninsured?
So the testing issue, it baffles me, and you've seen it go, the back and forth go between the governor, our governor in particular, and the president. I struggle with that. I will be honest. And we see that, but the issue is that we did not have the supply, and we're learning things every day. We saw where certain supplies were going out of our country when people were telling them, no, we need to keep this because it's coming on our shores. It's coming here. We did not have the supplies. I was on phone calls, and we do phone calls, and there's this boasting and thumping of the chest that you're going to get these tests. Now you're going to get rapid tests. We saw hospitals that when they did communicate, when they started communicating, they were like, hey, we have this drive up. I can just speak for the community I live in. We have this drive up testing mechanism now. Then we realized, no, it's a drive up checklist, but people were getting turned away because they did not have the tests. And I think you probably saw that in one of the previous slides. You saw where somebody was told, no, you can't get tested even with all of your symptoms. We only have 300 tests here in this area. Might have been the state. So that still needs to unfold. We are still asking for testing data. And so that is a demand that you will see from me, is that we still need the data that we have broken down. We need testing. We don't have testing data. And so there are people who are calling on the data broken down by however we can get it broken down. If we can get it broken down by types of insurance, then we will get that. So really, to be honest with you, it just was not testing going on here in Michigan. It just wasn't happening. And so I think it'll be startling when we do see who did get tested. And we also have to remember, going back to that slide around misinformation and miscommunication, it was people who traveled. Had you gone or had you been around someone who traveled to China at first? I think I can't remember I was on a call, maybe March, it might have been March 11th or March 10th, March 9th. And that's when we found out that Iran and some of these other countries were surpassing China. And that happened very fast. So even if people traveled or had been around someone, they were not even being told the right people to look at. So I could go on and on about that. And I think we might talk about some of that later on. I don't know if I put that, but that is a huge question of mine. And that's a huge burden on my heart to know who was tested. And you'll see later on is that the NAACP is now asking some of these questions. And so there's an opportunity to give information on that. So when we talk about shelter, I just heard Reverend Rosalind Boyer, she's out of Detroit, say this in a news report with Democracy Now! Shelter is defined as having a place of safety, comfort, and protection. So we know that we have water insecurity. Angela, you talk about housing insecurity. Many of us talk about that. When we look at places like Detroit or Flint, where we've had water shutoffs or lack of access to healthy, safe water, we know that people have to wash their hands. We also are telling people to stay hydrated. There was 140,000 water shutoffs since 2014, 10,000 reports of water issues after the moratorium that just went into place, after there was long fighting to get the water back on. It didn't come on until somewhere about a couple of weeks ago, that there was a moratorium on shutoffs and people have to do turn-ons. So 10,000, but only 1,000 have been reconnected in Detroit as of March 31st, 2020. So there are several people who cannot wash their hands, who cannot drink water. We can look at that in Detroit. We can look at that in Flint. Okay, let's move on. One of the things when we began to see this, my niece and I, we just started to think, hey, let's just start talking to people. So, and we started calling it Public Health for the People. And so these are just some of the sessions that we had. And so we just uploaded these to YouTube, but we just did live sessions. We talked mental health. We talked to the faith-based community. So we talked physical, mental, as well as physical health and spiritual health. And so we've had medical doctors, and we wanted people who look like the people that we knew were being impacted the most, even before we had the data to show that. We also started to talk to people about some of the things that we learned as an environmental person who worked in the environmental field. You know, I've ran a radiological site, or I shouldn't say a site, a lab, where there was a radiological material that was on a site. I've worked with with lead poisoning and out on those sites. There are just things that we learn about hygiene in those type of environments. These were people who were now the essential workers who had no clue how to protect themselves and their families from carrying this virus around, to be a carrier. And so we just began to have those conversations. And I asked my friend Donnell Wilkins, who has done environmental cleanups or helped people of color and or low income to learn how to do cleanups. And she began to use her NIH training, National Institutes of Health training, to then be able to help people, childcare workers, the folks who are making sure that we're fed, to make sure that they were not putting their families in jeopardy. So we just things that we knew were not happening. Senator Warren and Congresswoman Ayanna Presley called for the data to be broken down. There were some other people, I think Kamala Harris was a part of that, but these two were out front that were, Senator Harris, that were calling for the data to be broken down. We needed to see this data so that we could prove what we already knew. You know, we always have to have the actual empirical or the quantitative data. We had the qualitative, we have substantive qualitative data, but the quantitative data always tells the story. And so, as somebody in Milwaukee had put, that there are layers upon layers of history making it harder for Black communities to defend themselves against the virus, on top of all of these other circumstances that we were seeing. And so we were able to quickly see that 40% of Michigan COVID-19 deaths were from Michigan African Americans, whereas we only made up 14% of the Michigan total population. Let's keep going. And this, I think, everything's going so fast. I think we just got this data like last week. Detroit residents make up 7% of the Michigan population. However, I think they're 24% of the deaths, and I think it's, it's 24 and let's say 26. I'm going to say 26% of the deaths and about 24% of the cases, but only 7% of the population. These are just two communities that I pulled out. Let's look at Genesee County. 50% of those cases are in Flint, the city of Flint, is already dealing with the water crisis still. 20.3% of the population are African American. However, 50% of the cases are African Americans. When you look at where I live, Saginaw County, we're 19.3% of the population, and we're 28.4%. So somebody could look at that and say that's good, it's only 28.4%, but when you look at the disproportion, because we're only 19.3% of the population, you have to look at the data carefully and you still do see that there's a lot going on there. Looking at the Saginaw County data, I know the Ingham County, I think that we're almost 100,000 less population, but we have more cases than Ingham County. I haven't looked at Kent County's population, but we have more. So when you get these tight spaces and you have these cases, those things start to really worry me. So smaller populations and more cases. And so 1/3, this is across the US, 1/3 of the deaths are due to African Americans. And so Wisconsin is faring the worse, where Blacks, African Americans are 5.5 times more likely to die to COVID. And then Michigan follows, and we are 3.6 times more likely to die from COVID than others. We know, we look at the corrections. Now, this one definitely weighs heavy on my heart, because that's a contained population, and we see this number jump every day. So we're at 429 COVID cases. If you looked at one of the rates, and I don't know, we probably passed it, but they're in the top 10 for the number. If you look at Michigan Department of Corrections, along with our federal correctional institution here, we are in that's in the top 10 for the number of cases and deaths out of locations, if you put them in with the counties. And the city of Detroit. And there has been, from the federal to the state, there has been guidance provided for allowing people to be released from this system. And so we need to look at that. And I know, Angela, you are really advocating on that. Michigan, 17 months on average, higher than the U.S. for the number or the time served for certain crimes. So we hold prisoners longer, and I won't get into that data. Let's keep moving. So when we look at a racially equitable response, we know that we want equitable testing. We want to see that testing data, treatment of whether we're talking about prisoners or whether we're talking about all of us. Targeted communication. So communication that relates to certain populations. And I think certain populations need to see certain people in front of them to be able to understand this. And then equitable resources, as we're allocating resources, make sure that we're not left out of that, not just while we're going through this, but then on the other side. The NAACP, they do have a link, and they are asking people. It was just released 2 days ago. And so this is a link, and I'll see how Angela can get that to you to report discrimination if somebody went to get tested and they couldn't. We just want to hear those type of stories. Today I'll be on a call. Actually, I was invited on a call with Martin Luther King III. They're doing a call with CDC representatives. And some of the things that I will be asking for, Angela, I'll take your One Love Global, you and Sarah's demands, requests, but increase in testing, better tracking of exposures, protection of workers, and then making sure that we're looking at our folks who are incarcerated and seeing how they can be better treated. And then we know that we want to demand equity and response efforts before opening America back up. The other thing that would have been under demand under number 2 is also making sure that we're not, that the Tuskegee-like experimentations are not going on. We already see that that's happening with the hydroxychloroquine, where our communities, Henry Ford in Detroit is running this experiment. I don't know if it's going on at the other sites in the other communities. And then we need to have real talk and some real conversations. The faith-based, I probably have lost friends. I don't care, lost friends. I don't mind doing that as long as I can see them on the other side of COVID. But we've had some really tough conversations with the faith-based communities, and there's been a lot of death in the faith-based community. Most of them are not meeting. A lot of the exposure happened like in that second week, like around March 8th. So really it was, again, part of the communication that was not getting out. But the unfortunate thing is that a lot of people have learned about COVID because of the deaths of big, very strong leaders within our community. Just recently, last week, this to the far left is in I think that's in Flint. In the middle is Saginaw, but these were balloon releases. One was in memoriam of a COVID, someone who died of COVID. So all of these people came together, standing in no social distance whatsoever, to memorialize someone who died of COVID and do a balloon release. This one in the center is a Facebook friend of mine that I saw doing a balloon release. And there's about 50 people there. To the left, we see our first responders. I think this was in Grand Rapids, I'm sorry, to the far right, we see first responders, one without a mask who's responding to, it was a gazillion people out there. And so we know that the way that people are responding to this illness and lack thereof also has to do with disparities within our community. I was on a radio call, and there was a lady who runs a youth home, a homeless shelter in Washington, D.C., and she said one of the youth there, she was telling them, be safe, be careful, you need to stay out of the streets. And his response was, some people will get it, some people won't, some people will die, some people won't. But for me, I have so many things going on in my life, I just can't think about this right now. So we know that we have a response that we see as not responding, but people are responding. But because they have so many issues that, again, that layer upon layer that were already existing, that it's hard to get them to put this in focus. I mean, we've already had people walking around thinking that they were going to die and nobody cared about them. And so now all of a sudden people care about them and are asking them not to do anything that's going to harm anybody else or cause them to die. And people are really having a hard time prioritizing this right now. And we're seeing this, but having those tough talks and conversations with our loved ones, including our faith-based community. Okay, let's go. I think that was the last slide. So these more information, I'll have to get that to you guys, but there's COVID testing information on the CARES Act, mental health, employment issues.
Thank you, Pam. No, that's a lot of information. And so we do have a few questions. So, okay, question, and you kind of touched on this. What are your recommendations on altering and publishing language that is more culturally competent for racial and ethnic groups and while maintaining the integrity of science?
It has to be done. It has to be done. I was on a call a couple of days ago with a local community, and they were saying, hey, we need to start communicating to people. I was like, that train has left. I said, what I did is I took whatever information I could get and I just started hollering at people, hollering in a nice, loving way. We would get about 1,000 views, anywhere from 600 to 1,000 views per session. And we would just, as we got information, my niece and I, we would ask other people to come in and we would just tell them, hey, come in here, let's get in, let's have these conversations. We got to break it down, and we have to have real talk, and that's it. And so that will be something that I will bring up today, given the opportunity. And I think I did see the CDC saying something, but it needs to be people who know how to reach these people. There are some people who just don't understand what we're talking about, because you went from 250 to 50 to 10 to 0. You said, say stay 6 feet away, I'm good. You said wear a mask, don't wear a mask. People are confused and they check out. So yes, we've got to get the information, get the right people saying the right information, fact-based, but it's got to be timely. It's got to come from people who can penetrate, and it has to be a message that they can hear, and it has to
It's
be right
1 o'clock.
Oh, there was just a little message saying that it's 1 o'clock. I'm not sure what that means. I guess it.
That was my computer.
Oh, okay. So we do have a few more questions here. So I'm going to keep going, Pam. What specific recommendations do you have for an equitable response before the country opens back up?
Hey, they got to get testing, and it's got to be, for our prisoners, it needs to be like total population. We need to be able to see the data. We need to know about where we are with immunizations, where we are with building immunity, how we're going to make sure that people can respond. Employers are going to be sensitive to the needs of our employees. Many are caring for elderly adults, young children, and we cannot keep shifting who's going to give the message of how you provide PPE and how you make sure it's adequately used. Several things, but the economy is being pushed to reopen, and we know the people who will be the sacrificial called essential, but the sacrificial folks who will be there, expected to be on the front lines.
Yeah, they're on the front lines now and they're dying. So yeah. I think the last question here, just to keep us as close to 1 o'clock as possible. Do you feel that Governor Whitmer's task force on racial equity in COVID-19 cases will help mitigate and improve the response in these communities? Are you a part of that task force? Do you know anyone who is?
I'm not a part of the task force. I was talking to someone, a public health leader who had talked to another public health leader. They were not aware of who would be a part of that. I don't know. You know, to be honest with you, I'm tired of all of the politics. There are just things that we know. There are things that should have been happening prior to, leading up to. I don't know. I don't have a response to that. All I know is I can just hit the ground running. I'm trying to keep myself healthy, trying to make sure that I stay in touch with people like you, and just trying to get to the people. I don't know if another task force will do that job. It's a nice gesture. I like I said, this was somewhat cathartic or somewhat um, therapeutic for me to get out some things that have just happened throughout just this pandemic, let alone years and days before that we knew to do. I don't know. I don't know. We just need to do. We just need to do.
Thank you, Pam. I definitely appreciate all the information that you've shared in this presentation. Again, this presentation recording will be on the One Love Global website, and so we promise that there would be some action you can take. One is if you are concerned about your loved ones and even people that you don't know that are confined, as Dr. Pugh said, and contained in cages, there is a drive up to the Capitol tomorrow to protest and get our folks out of those cages so that they can be safe and protected as well. And then on Thursday, we are inviting you to join a call with the Movement for Black Lives. This is an ongoing series. So tomorrow night, Thursday, April 16th, 7 p.m. We invite you to join to get more perspective on a racially equitable response, what's happening in our communities, and the information that we need to know to keep ourselves and our communities safe. And we'll just invite you to stay tuned, sign up for our ongoing webinars, and we will have another webinar for you next month. We look forward to seeing you on future calls, and I'm going to turn this back to Sarah for the last word here.
Thank you so much, Angela, and thank you, Dr. Pugh. That is extremely helpful information. Feel free to reach out with any additional questions, and we'll follow up as much as possible. Also, feel free to let us know about what types of learning materials are helpful for you at this time, or what you might want to see in future webinars, and we will try to be responsive to that too. That is all. Thank you all so much again for joining, and have a great rest of your day.